member of JPF iBRETA, co-leading JPF iBRETA training. I am happy to welcome you all to our inaugural series of training, Don't Whisper, Let's Talk period. In this series, we have 4 sessions of menstrual health and hygiene. In last session, we covered monthly hormonal circus. In today's session, we will understand more about menstrual well-being, covering diet and hygiene. Before we move to the session, I will give a brief introduction of JPF and iBRETA. JPF stands for Jnana Prabodhini Foundation. It is a non-profit organization founded in 2019, which is based in California, USA. It has a mission of rural development, women empowerment, and education. Moving on to iBRETA, that is Initiative for Biosciences Research, Educational Training and Awareness. Our iBRETA program is under Jnana Prabodhini Foundation. It aims to create a platform between medical and research community to tackle problems of healthcare, to create awareness in community about different aspects of health and diseases, to develop scientific mindset among young students. Our project is divided into 4 different sub-projects: research, education, awareness, and training. In training, we aim to provide expert guidance and training so that people can tackle important issues of public health at individual, family, and community level. These were our previous health katta sessions under awareness. We had our first training session last week where Dr. Girija Wagh spoke about hormonal cycle. In today's session, we welcome her to speak about menstrual hygiene and diet. She has experience in OBGYN for almost 29 years with specialty in IVF. Her areas of expertise include infertility, neonatal care, PCOS, etc. I would like to ask Dr. Girija to commence our session.
So, hello, good evening, everybody. And it is extremely, sort of a heartening to see all of you here with a lot of enthusiasm to know about your own body. And it definitely gives me a lot of, sort of a satisfaction that we'll be having some very, very important things to discuss today. So today, as has been allotted to me a task, I will be speaking to you about diet and hygiene in menstrual well-being. And here I'm also going to not only cover about nutrition and hygiene, that is physical hygiene, but also about some mental hygiene is going to be some part of this particular talk. So this is what has been allotted. Thank you so much, Jnana Prabodhini Foundation and the iBRETA. And I really want to congratulate you all youngsters for making it very important to look at women's health, and especially something which is so normal, so physiological, and make it a part of this discussion. So coming to the first aspect of our talk today, the nutrition. Basically, we're to understand that especially during menstruation, you must ensure that you're taking better nutrition. For that matter, nutrition has to be pan your life, a very, very important intervention which has to be taken properly. It's not something to just appease your taste buds or something to fill your tummy. It has to be a very, very intelligent kind of an intersection that you're doing in your daily living. And then here, in addition, during menstruation, you have to ensure that there will be some way in which you'll be able to alleviate pain and protect yourself against anemia, especially when girls bleed a lot, or if they're not taking proper diet, they're already anemic, their anemia can become severe. And we here in our country yet haven't been able to tackle that very important problem of anemia, which affects all the health parameters across the woman's life. Now, we all know that there are certain problems during the periods, and these are blood loss. There can be hormonal imbalances, which can give rise to cravings. There can be painful cramps. There can be constipation. There can be indigestion. Many times there's a lot of indigestion, dyspepsia, and then sometimes there can be bloating. Now, usually all of these seem to be associated with nutrition during menstruation. And let's look at what the research says. The research says that taking a lot of green leafy vegetables during menstruation helps phenomenally. And how does it help? Because it's been found that green leafy vegetables are very, very rich sources of iron and B vitamins, certain folates, magnesium, zinc, as well as iodine. And all these are important for our bodily functions and simple things that are essential in our day-to-day functioning. Now, when we look at surveys generally through community, and if I ask my patients to write diet recalls, very commonly I find that green leafy vegetables are not taken in the right way. Most of the times we take very less quantity. Many times it is oftly cooked extremely, and then the green leafy vegetable is consumed. Now, while we are doing this, we may have lost a lot of micronutrients, and then we are also losing a wonderful natural sourced micronutrient, sort of a source which is so much rich in these things and which can help us in having a better health. Another very important thing that has been found is the fiber content. Now, it's very important that vegetables will give you a high fiber content, and fibers are of soluble and non-soluble type. And all these soluble as well as the non-soluble ones are extremely essential because they help in your proper gut movement. They help in alleviating constipation because during menstruation, there is pelvic congestion, and that pelvic congestion may cause constipation, bloating, and that all can be reduced by taking vegetables. Additionally, bloating is a result of hormonal changes giving rise to retention of water and sodium. Now, green leafy vegetables contain a lot of potassium. And we all know that if you have to take sodium out of your body, you require to take anything that is rich in potassium. So taking a lot of tomato juices or taking salads in large quantities or vegetable juices or coconut water, they're going to help you to remove that sodium retention and likewise help you in relieving bloating, which is a very common feature during menstruation. Another important thing, which is very, very essential, which should be practiced not only during menstruation, but through your entire daily routine, is ensuring that you're taking foods which are rich in omega-3 foodstuffs. Now, they are definitely more filling, especially nuts are very rich sources. You can see that fish, then certain oils, then certain seeds, and nuts, especially eggs. They are all very, very rich in omega-3 foodstuffs. And they're 100% definitely better than junk. I'm going to come to the junk factor as we go by, and they're more filling, and therefore, and they are also replete in nutrition, and omega-3 has been proved to be a very, very important nitric donor, and therefore it is a very, very high quality antioxidant essential at this point in time. Now, when we're talking of omega-3, each one of us has to be aware of the omega story. And what is this omega story? You have to remember that omega-3 out of this is very, very important and not the omega-6. Whenever you fry stuffs, these omega-3, very, very valuable ones, can get converted to omega-6, especially smoking in the oil, frying, can give rise to release of this omega-6. And omega-6 is therefore known to be not a very good conversion of omega-3, which we all have to be aware of. So whenever you are making any food stuff, even if you're adding a little oil for, let's say, tadka or something, ensure that it doesn't smoke and convert into omega-6. Because omega-6 is going to give rise to a lot of inflammatory responses in your body. So if you eat plenty of omega-3 fatty acids, the delta-5 enzyme is used in the omega-3 pathway so that less omega-6 is converted into pro-inflammatory prostaglandin 2, which can cause a lot of inflammatory processes in your body, giving rise to various kinds of side effects that we experience. Another important component of food is fruits. Again, a very rich source of micronutrients and fibers. And especially when you look at fruits which are very commonly produced in our country, like the papaya and the mango. Typically, these are my frequently asked questions in my clinic, where I'll be asked, Madam, can I take papaya? Madam, can I take mango? Mango se garam hota hai, mango se pimple aata hai. I think these are only myths, because we have to understand that papaya are very rich sources of vitamin E, C, folate, and potassium. They are excellent energy sources, have a lot of fiber, good protein, good calories. So it's a wonderful food to give you energy. And likewise, mangoes, not only are they both of these stuffs rich in vitamin A, D, and C, but usually mangoes have a very positive impact on your mood swings. And it is known to reduce anxiety and bring a lot of happiness and calmness. And we all will always feel, we love to eat mangoes, and we must eat mangoes, especially if mangoes are garam. I don't understand. Then if they were garam, why would the nature give them during summer seasons? So there is a reason why mangoes come during summer season, because you sweat a lot, you get flustered, you require to have a good energy, a good source of nutrients, and that is the reason why mangoes are coming to us during the summer seasons. So by and large, if you look at the summary of what you have to look at as fruits are concerned, take loads and loads of green leafy vegetables, which will help you in alleviating the constipation and the bloating effects. Nuts, because they are full of nutrients and they give better sources of energy than the junks which you may crave to eat. Take a lot of fresh fruits which are good for your system as well as your brain and your mood swings. And always get into the habit of changing your millets on a daily basis. Don't every day take gehu. You can change sometimes to bajra, jawar, some other options, so that your gut health comes and remains maintained. And you can always consider using good sources of iron. Red meats are, even green leafy vegetables are good sources of iron. But the problem with vegetable sources of iron is that there are phytates in this vegetable which may not allow the iron absorption. So if you see in our households, especially in Maharashtra, we put tamarind in the vegetable that we cook. Tamarind and jaggery, they are known to reduce these phytates and thus increase the iron absorption. So you must ensure that you're taking also diet which is much rich in proteins, because the body is undergoing a lot of wear and tear, and you require to replenish it with proper healing, macronutrients. Another important thing during periods is drinking a lot of water. You must, because you perspire, then you may get dehydrated, you may start feeling weak. So it's very important to drink a lot of water, because especially warm water is found to be very ideal. It's not nice to take chilling water from the fridge. You can take either a room temperature water or a warm water, because it will not only help you with weight loss, but it will relieve your menstrual cramps. It will cause you better digestion. It will give you a better sleep, and then it will also maintain a wonderful skin, which is very, very important to take care, because finally we have to look healthy, and health is always reflected in how you look, and therefore skin is important. Now, as I mentioned that it is important to increase the iron intake during periods to compensate for what is lost during each month. And iron helps in avoiding anemia and symptoms that can go along with it. That is one. And secondly, eating red meat helps in getting sufficient iron from food. But if you are a vegetarian, that you to ensure that you are taking proper iron sources. And this can come from your alternative sources, which will ensure that your iron stores are adequately maintained. And please, please, please do not venture into taking any kind of, junk, especially bakery products, because they contain refined flour, they contain a load of trans fats. Then beverages which are high in sodium content, junk food should be avoided. And these all are going to cause this uncomfortable bloated feeling. I always give this an example to my patients, that for example, now we are hungry and I'm hungry now. So if I go and take a nice clear vegetable soup, or maybe a sweet corn soup with chicken in it, or maybe any kind of a simple clear chicken soup, that with a salad, that will be so nutritious. But in the pang of hunger, if I go and eat, let's say, chola bhatura, and then I feel so very nice while I'm eating it, so tasty and lovely. But then I keep on having something in my throat, then I want to eat, maybe take lassi, or maybe I'll take some cold coffee. And then maybe at that point in time, I'll feel very, very satiated. But within about half an hour or 40 minutes, I start feeling that I'm, so tired after eating that food, and that I'm not getting that nice feeling. This will definitely happen if you take loads of salads and vegetables and avoid this kind of combinations which we are commonly taking. Now, the another component, as I mentioned to you, is the mental hygiene that we have to think. Thinking is a hygienic process. You cannot, just because you've been given brains, you're not continuously going to think. You have to have what is called as a thought hygiene, because unnecessarily thinking creates a lot of stress. And this stress is definitely harmful. And there have been more than enough studies which have shown that stress causes anovulation, that is, absence of ovulation. And this was what was studied in this patient, in this particular publication, where they looked at women who were having irregular cycles or not having cycles at all, amenorrhea. And then they decided to find out what was the cause. And the cause which was found in nearly 34% of these women was stress. And this stress causes functional hypothalamic amenorrhea. Just remember, there's constantly stress in your frontal lobe, which is going to affect the hypothalamus that I described to you yesterday, and that can cause disruption of your menstrual cyclicity. Likewise, stress can give rise to a lot of work coming from the adrenal glands, which are sitting on your kidneys, giving rise to hyperandrogenism, lot of steroids getting pushed into your body, giving rise to PCOD or hyperandrogenism kind of symptoms. Likewise, too much of thinking can give rise to hyperprolactinemia. This hormone comes into your body related to stress many times. And these all can result in premature menopause. Now, ovary becomes so stimulated by these stress factors that it stops functioning very early in life. And Asherman syndrome is a condition wherein the uterine cavity gets infected due to recurrent pelvic inflammatory diseases or any sepsis related to post-abortal infections or any kind of post-delivery infections can cause harm. Tuberculosis is very common in our country in young women, and that can destroy the lining of the uterus, which can cause Asherman syndrome. So when a person is under chronic stress, the HPA, the hypothalamo-pituitary adrenal axis, is activated, which leads to increased levels of cortisol and corticotropin-releasing hormone. And these can suppress the normal levels of the reproductive hormones, which can potentially lead to abnormal ovulation and ovulation and amenorrhea, that is absence of menstruation. So no ovulation or irregular ovulation, and then typically these women will come bloated, weighted, with all hair on the body, pigmentation here and there, and constantly worried under stress and no cycles coming on time. And this definitely impacts even the ovulation, because so much of disruption occurs in these hormones that the LH secretion, which we learned last time, may not happen on the right time. Ovulate, the FSH will not come on the right time. The eggs will not grow properly and the ovulation will not occur. Now, this doesn't only affect the ovulation, it may directly or indirectly even affect the lining of your uterus, where many times women come, doc, I'm not getting pregnant, I'm having irregular cycles. And then we found that the endometrium, that is the lining of the uterus where baby is supposed to be formed, all goes for a toss, because the endometrium has no proper hormonal receptors where the baby can come and get attached. It doesn't have proper hormonal receptors to respond to the receptors properly so that the cycles will come regular. So you can see how stress will cause impact on the brain, the hypothalamus and the pituitary. This will stimulate the adrenal gland, which is sitting on the kidney, and that will cause activation of the hypothalamo-pituitary adrenal axis. The stress hormones act as stress mediators, which go on the human endometrial dysfunction, the lining of the uterus, and they completely disrupt the HPG, the hypothalamo-pituitary ovarian or the gonadal axis. And all these wonderful hormones which are coming cyclically in your body get disrupted. Ovarian release of hormones gets disrupted. And when you do your blood test, all kinds of level changes will happen in your body. And this will cause complete obstruction of the lining of the uterus. Doesn't grow well, it doesn't function well, its internal genetic expressions get disturbed. And then women find it very, very difficult to have a regular cycle, a proper ovulation, and in the later half, the later part of your life, even to get pregnant. So this was an aspect of hygiene, which was mental and thought hygiene that I mentioned to you. Now coming to the physical hygiene. Now during menstruation, your body is continuously secreting menstrual blood. We learned that it is the lining of the uterus with some cells which is coming out of your body. There are certain secretions which are coming out of your body. And during this time, your immunity is a little lowered, and therefore it's very important that you have proper hygienic practices. Now, there are a lot of menstrual hygiene products which are available on the market and which everybody can use based on their personal choices. So the products which are commonly are the sanitary pads, which are used either to line the lining of the underwear, or there can be, some pants which can be worn, which are disposable, absorbent pants, which are made up of a very friendly material and which are washable. Nowadays, they are available on the market. And then there can be a tampon which can be inserted in the vagina. It's an absorbent material, a very small one. It gets into the vagina, it swells up, take the menstrual blood, and you have to discard it. And then there's a menstrual cup, which nowadays a lot of modern girls and women are using it and find it very handy. And this is something which you put inside the vagina, collecting all the blood that is coming from the uterus and the cervix. And you have to take this menstrual cup out, empty it, clean it, and again insert it inside. So these are the commonly used things that are used in the long past. Women, and now again there is a huge awareness, we can also consider using homemade pads. Now these homemade pads are made up of clean cloths. So they are cotton cloths, they are very soft, washed repeatedly with detergent and then dried properly and then softened so that they'll be skin friendly. And you can convert them into a nice pad, which you can use, clean them again, and you can consider reusing if the cloth is fine, or you can consider washing them and then disposing them off. So using cotton homemade pads can also be a good practice, because then you are not worried about any kind of pressure on the environment because of your sanitary products. Usually the very typical sanitary pads are made up of certain absorbent materials which uses plastic as a liner. And these are very, very difficult to dispose of, and they can cause a lot of environmental challenge. And therefore now there is a huge awareness that you must use products which are not going to go and block your toilets. Many times girls are in a very bad habit of throwing their sanitary products anywhere. They will put it in the flush. All the flushes of all the toilets are not meant to take such heavy loads. And sometimes I have seen such bad practices practiced on a flight. And just imagine if you block the toilets, what will happen to a closed environment like a flight. So you have to be understanding that the regular toilets are not meant for disposition of the sanitary products. You can just wind them in a piece of paper and then put them in a dustbin where it will go and get processed with all the trash that is in the can. And as I mentioned, it is always better to use environmental friendly products. Now, how often do you change these products? One is anything, even if you're using a menstrual cup, whether you are using a panty liner, a panty, a sanitary pad, or a tampon, after 4 to 6 hours, depending on how much bleeding it is, you have to change this. If you keep them for more than 5 to 6 hours, there is a bacterial growth which happens on this because it's blood coming from your body, and that can help bacteria to grow, which can cause you serious infections in the lower tract. Also, as well, it can cause infections in the genital tract. If you forget to take your menstrual cup out, or if you forget to take your tampon out on time, it can remain there and act as a source of infection. And there have been women who have landed in what is called as a toxic shock syndrome, because that blood remained there, caused inflammatory process, sepsis initiation, and they went into, they had to be taken into an emergency. So you have to use and choose your products correctly. If you're using your sanitary pads, try to ensure that they are healthy, clean. Wash your hands whenever you're touching any part of your body, and ensure that your sanitary products are placed in a proper way and disposed in a proper way. They cannot be kept for public viewing and cannot be thrown anywhere wherever you think that's right. That's a very, very bad practice. I remember in the small villages, I come from one of those places. I come from Nevase, where Naneshwar Maharaj wrote the Naneshwari. And I'm very proud of where I come from, my roots. And I'm very proud of my, my lineage, the way my mother brought us up. And it gave us a legacy that we have to speak about these menstrual health and hygiene properly to all those people who are around us. And I remember that time that this was taught to us that you are not supposed to put your pads anywhere for public display. Unused pads are not to be thrown anywhere. They have to be washed yourself, clean, dried. She had one, she had made a nice sort of a saucepan, and on which we could boil those cloths, dry them. She had made a place for us to dry them, use a softener, and then we used to always use clean pads, because that time when we were young, sanitary pads were not very easily available. And she was not very happy with us using any of those plastic, undegradable products for a long, long time. Now, a lot of things have changed over a period of time, and we have an access to proper kind of products, but that was the thing that was taught to us. And then there used to be this thing in those villages that agar aapka you use pad, if anybody sees, or if a snake bites it, or any reptile bites it, then you will have problems. You will have problems with infection. You will have problems with not getting pregnant. So this was their way of inculcating fear. And now with the knowledge, we are seeing it's so unfortunate the way sometimes toilets are used by women. They don't even bother to clean when they soil the toilets after they have, passed urine or whatever. And then they just keep the menstrual products, the sanitary products, as if, and in whichever way that is. It's so very sad. We have to understand that we belong to a civilized race, the most highly civilized and evolved race of human beings. And women should not display any of their dirty things anywhere in the public. And this hygiene, therefore, is extremely important. So changing your pads frequently, ensuring that your private parts are properly clean, seeing that you're taking proper shower. You have to clean your body. You have to wear fresh clothes. You have to use clothes which are ventilating, especially we are in a tropical country here, so cotton clothes, and ensure that you're cleaning your underwear and changing them on a regular basis. Because you can there can be certain vaginal infections, and they can cause a lot of problems. So with this, I would like to end my talk. If there are any questions, I'm ready to answer them.
Thank you, Dr. Girija. I hope you can all hear me. Thank you, Dr. Girija, for this amazing talk. And we actually had a lot to learn, and because these are like a very common problems that we face every month. So it was actually really interesting to hear there are these really quick solutions and something which we have to control, not to go for the samosa, but maybe a fruit in the evening. So thanks for that. So we got many questions during our registration. So out of that, I would like to ask you a couple of questions to start with, and then you can start asking questions you have in the chat box. So one of the very interesting questions that we encountered was how to use public restrooms safely, because as a female, everywhere you can go, even if it is your workplace, it's very difficult because, as you said, there are many people, they are very unhygienic. So it's very difficult to keep that hygiene when everybody is not doing it properly. So the question is basically how to use public restroom safely.
So first and foremost thing is that if you're going to use a public restroom, you practice a non-touch technique as much as possible. Do not allow anything of your body. It's always better to have an Indian toilet But unfortunately, we are seeing that in most of our offices now, there are Western toilets, and therefore hygiene is a very important thing. What you can start using is there are certain cleaning sprays which come, which you can put sprays on the rim of the toilet seat where we are using them, or you can use toilet covers. There are certain offices which make a provision of a seat cover. You can carry your own disposable seat cover and use it while you're using the toilet and dispose it off properly. And you must definitely use some wet tissues to clean your private parts. You should not, allow the urine or your any of the other ablutions to be remaining on your private parts for a long time. They can cause infection, especially even the menstrual blood. And then you should see that you're not rubbing your private part too much, but it's clean. Just cleaning with a clean water is enough, and dabbing it with a soft tissue helps better. If you don't want to use a tissue, you can carry your own set of napkins, cotton napkins, which can be washed and reused and recleaned. Because nowadays there's a lot of things against using tissue papers also, because that's causing a whole lot of felling of trees. And therefore you can consider these very, very simple self-cleaning options which are there.
So next question is, what workouts can you, or workout or exercise can you do during your periods, and is it advisable?
Yes, of course you must, because what happens is when you go for a walk, there is a lot of circulation in your body. The pelvic parts of your body, they move, and therefore the lymph stasis, the blood moves. All the toxins which are there, all these inflammatory chemicals, they get distributed into the blood. And then that relieves the pelvic congestion. That also helps you in cramps. So you must walk. You must walk at least twice in a day for 30 minutes. That's the best amount of walk. Try to walk briskly as much as possible. You can walk briskly for that. And you can also continue doing light yoga. Now, don't do Shirsasana or something where your pelvis will be lifted up in the air. So that, because we don't want retrograde menstruation to come in. But you can use, light yoga, like standing, like simple things like what we used to do in school. We used to do those warming up exercises. Without jumping, you can consider doing it. These you can do without jumping. These kind of things can be done. But any kind of hectic ones where weightlifting, or, you can even do running if you want. But anything that makes you go ulta, don't do that. Or anything that squeezes your tummy, don't do.
Okay. So now we are starting questions from audience. So one of the questions is that, so there is a known B12 deficiency in Indian population. So how does that affect menses, and how do you detect that your periods are getting affected by the vitamin B12 deficiency, and how you can, counter it, or what can we do?
B12 deficiency has become a big challenge in the current era. The reason being that we are not taking proper care of our gut health. So gut health, because we tend to eat any kind of crap, and that gives rise to a lot of indigestion, gas formation. Acidity is so very prevalent and rampant in our community. And what happens is, because of that, those friendly bacteria which are sitting in your gut are the ones who are manufacturing that B12. They are completely destroyed because of your improper eating habits and your acidity. So how to identify whether you have a B12 deficiency? You'll have a shallow skin. You'll feel tired and weak. You'll have continuously actus ulcers coming into your mouth, which will cause a lot of, improper eating issues. So those the tongue becomes very, very reddened and painful. You're not able to eat properly. There'll be some cuts on your lip ends. All these can be signs of B12 deficiency. Simply you can do is do a test, and the test will tell you that you have a B12 deficiency. And when you have a B12 deficiency, go back, look into these problems, find out how I can improvise my diet, how best I can use the B12 sources. Now, it's believed that usually completely vegetarian people are deficient in B12, while non-vegetarian eaters are having B12. But it's not true, because even how you take the non-vegetarian food is important. If you're going to cook it so much and then you're going to put a lot of spices in it, then you will not be getting the requisite B12 any which ways. You understand? So This can be supplemented by injectables, by proper dietary practices. And how it can affect menstruation is B12 deficiency causes hyperhomocystinemia, and it can affect all the functions in the body, including menstruation.
Okay. So next question is that it has been suggested that phytoestrogen consumption in menarche have a beneficial role in the menstruation. So can you expand on the role of phytoestrogens? And along those lines, there has been one of the questions that what are hormone mimickers and what are their effects?
See, basically, phytoestrogens are not supposed to be taken ki abhi hum jaake phytoestrogen khate hai. No need. They are coming from proper diet. So there are a lot of soya, jeera, our regular condiments. They are quite rich in phytoestrogens. So if you take proper way food, which is not highly processed, you will not have any issues. So you will not have any problem with, these kind of things like phytoestrogen, barabar se lena hi hai. Not necessary. Secondly, hormone mimickers, like if you take too much of isoflavones, bahut zyada green tea pina lage, bahut zyada soya because it is giving you estrogens, that may cause certain disruptions and they may start acting like your hormones. And there are certain hormone mimickers which are manufactured, like they are made, they are given as a therapy. They are given as a therapy. Sometimes perimenopausal women, they require some hormonal supplements they can be given. Women are having abnormal uterine bleeding. So instead of giving the direct hormone, which we can give receptor modulators to them. Or sometimes if a young woman wants contraception, she doesn't want children. In those patients, we can give them, something like SPRMs, which are hormone-like products. And they can help her in avoiding an unwanted pregnancy. There are such medicines.
So next question we have is that, so does hyperthyroidism or hypo, how does it affect menses?
It causes irregularity in the ovulation. Hormone TSH, the hormone which is regulating the thyroid function, acts similar to any of the gonadotropins and causes irregularity. Sometimes there can be less periods, sometimes there can be heavy periods. There can be dysmenorrhea, premenstrual tension syndrome, disruption in the ovulation processes, disruption in the endometrial work. So all these things are happening because of hypothyroidism, and hypothyroidism also, according to me, is a lifestyle disorder.
So our next question is that, does caffeine help or not during periods?
Caffeine is a pain reliever. It's an analgesic. So thoda sa it will help, but it will not be a solution completely always.
Or especially, I am not sure if it is a myth or there is any evidence behind it. But people say that if you eat chocolate, especially dark chocolate, when you are on your periods, it helps. So
yeah, it helps. So why not go ahead and take it? It doesn't cause you any harm. Everything, small quantities does help. It is not, you're not taking it as a medicine in any which way, no?
So, yeah. So the next question is that how behavioral changes associated with the hormonal changes and how that is linked to the menstruation.
Behavioral changes, now one of the most famous stories of the past has always been premenstrual tension syndrome, or PMDD, which is called as, it was found that because of hormonal abnormalities, women would have certain thinking abnormalities, and this would give rise to behavioral change where they will feel bloated, they will feel angry, hysteric, depressed. And there have been some stories in the past in English literature where women have gone and caused murder, killed people, tried to kill themselves. So these are extremes. But as the hormones keep on changing their levels, there are mood swings occurring. Especially now, for example, you have a woman who is having endometriosis or any such kind of a disorder. If she has a lot of pain during her menstruation, when her menstruation comes, she's really flustered. She's disturbed and she's worried, kitna ho raha hai. Or if a woman is trying to make pregnancy or wants to get pregnant, if she gets a period, she will be usually worried. Of a woman who misses a period, she went into a sexual activity and wants to get period, and she doesn't get a periods, then she'll get anxious. So everything is related to something else associated with it. But then mood swings, and they are also a result of hormonal imbalances. So it is situational. It's very, very personal, and it is very unique to each one of the persons and the context in which we are looking at it. Women who are trying to come towards menopause, they would want to have menstruation. They will feel, oh my goodness, am I losing my menstrual cycle now? So, depending on all these things, you'll have it.
So as a adult female who is in her reproductive age, so for that female, what is the basically, when would you consult a gynecologist when you are having these extreme symptoms?
You must consult whenever you are finding that there's something abnormal. It's always better to see your gynecologist. The gynecologist will make a differentiation to find out whether you have any organic pathology, whether you have any functional pathology, or whether you have a psychological pathology. If simple counseling doesn't help you, you will be directed to a psychologist or a psychiatrist. Or you yourself can consider doing that, because most of us have that much intelligence quotient that we understand that there's something going wrong. We can always seek help.
Yeah, I think that's a very important point that you just mentioned, that so basically you have to observe your body, you have to observe what is going on every month and the changes that are happening, and then immediately consult a gynecologist if there is something wrong with that. So I guess we all should consider this point. It's very critical for all of us. And so the next question we have is that premenstrual flow, is it normal or abnormal?
It's not abnormal. So anything which is beyond the precinct, last time we discussed the menstrual cycle in details, and I told you that anything which is out of what is to be looked at the range for you, it is abnormal. It requires to be looked into.
Yes, so I guess if anybody has any more questions. Okay, so we have one more question, that vitamin E deficiency affects strength of tissue of the uterus. Is this a scientific fact? How can one overcome this issue with lifestyle and diet without taking any medicines or any supplements?
See, my dear, vitamin D affects all the functions in your body, from obesity to diabetes, to your brain, to your emotion, to your ovarian function, to your menstruation. Everything under the sky gets affected by vitamin D deficiency. So go out in the sun at least for 20 to 30 minutes in a day, or at least for 2 hours in a week, in the right time between 11 to 2 a.m. and you will get your requisite vitamin D. Eat good food so that you don't get acidity, constipation. So it will be taking care of your vitamin D.
Yes, we have more questions.
How many more questions? Because now I have to get into my consulting.
Yeah, no. This is the, and it was vitamin E actually, not D, but I guess that's also important.
Vitamin E also is, important because it causes bloating if it's deficient. It will cause menstrual cramps. It will cause cramps and pain in your lower legs. So taking food which is called as balanced diet is important. Don't break it up into supplements. Eat everything that's healthy and nice for you. And do your own auditing. What works for you, you know the best. There is no fixed plan for anybody for diet. You have to look at your lifestyle, your needs, your practices, and what makes you feel better, and eat accordingly.
Yeah. So I guess thank you for this wonderful talk. And there were a lot of good questions also, and it's an important takeaway message is observe your body, observe the changes, and eat healthy. Basically, it's good for you. So I guess I'll hand over to Anushka.
Thank you, Dr. Girija, for both of the insightful sessions. This was our second session of the series. Next 2 sessions will be conducted by Dr. Vaishali Biniwale. The third session will be consisting of menstrual disorder, cause, diagnosis, prevention and cure, which will be on 3rd of June. And the 4th session will be an interactive session on menstrual products. That will be on 17th of June. I would like to thank all of you for attending. I would like to thank Jnana Prabodhini Prashala, Jnana Prabodhini Alumni Foundation, Jnana Prabodhini Foundation USA, our iBRETA team, Jnana Prabodhini Project Planning Committee, JPF social media team, and JPF website team. Please ensure that you will be joining our next sessions as well. Thank you.